Hello, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss the mechanics behind deconditioning. When we suffer from chronic illness, one concern we have to contend with is deconditioning. There can be consequences to all our rest and downtime. Deconditioning can result in reduced functional capacity of many of our body's systems, but mostly our musculoskeletal system. Inactivity is not a natural state for people, resulting in negative consequences. Leading a sedentary lifestyle causes many physiologic adaptations in all of our organ systems. Deconditioning occurs at several levels and can be mild, moderate, or severe. Mild suggests difficulty with maximal activity like swimming, running, or most types of exercise. Moderate deconditioning suggests difficulty with normal activity like walking, shopping, or doing chores. And severe suggests difficulty with minimal activity like caring for yourself. Deconditioning leads to general muscle weakness, loss of performance, and muscle atrophy. The pathophysiology of contracture development suggests that within just 5 to 7 days, the connective tissues are maintained in a shorter position. In less than 2 weeks, the muscle fibers and connective tissue adapt to a shortened length by contraction of collagen fibers and a decrease in muscle fibers. In 3 weeks, loose connective tissues in muscles and around the joints gradually change into dense connective tissues. After a short period of a few weeks, you run the risk of bone density loss due to increased reabsorption, caused by the lack of bearing weight, gravity, and muscle activity on bone mass. After 3 months, an increase in the excretion of calcium in the urine and stool becomes present, reducing bone density to around 50%. At this time, especially the long bones become diseased from the marrow outward. The risk of osteoporosis significantly increases, and heterotropic ossification can then occur, where the soft tissue surrounding the bones form mature bones. And then cortical thinning occurs at the ligaments. The joints become subject to flexion, contracture, cartilage degeneration, fusion, synovial atrophy, fibrofatty connective tissue infiltration, and osteoarthritis. Within 1 day of bed rest, cardiovascular changes occur such as increase in resting heart rate, a decrease in blood volume, fluid shifts, and maybe even POTS. Atrophy of heart muscle, decreased minimum oxygen consumption, increases in clots, deep vein thrombosis, and pulmonary emboli. Increased risk of stroke, depressed levels of hormones, decreases in pulmonary function, and reduced muscle strength and endurance, reduced movement of the diaphragmatic, intercostals, and the abdominal muscles, the development of cough, mucus plugging, and pneumonia, increased risk of pressure ulcers, dependent edema, and subcutaneous bursitis. Deconditioning can then lead to GI issues like decreased appetite, decreased gastric secretion, constipation, mucosa and glands, and a distaste for protein-rich foods. Risk on increased diuresis and mineral excretion, stone formation, urinary tract infections, metabolic changes like decreased lean mass, increased body fat, disorder of nitrogen balance, and loss of mineral electrolytes. Psychosocial risks like depression, loss of control and motivation, anxiety, fear, neuroses, decreased concentration, feelings of helplessness, increased psychotic behavior and apathy, increased irritability, increased feelings of self-isolation, decreased motivation and ability to participate in activities, impaired judgment and problem solving, loss of independent activities and daily living, loss of hobby or social pursuits, and an increased chance of job loss. You could have central and peripheral nervous system issues as well, a disorientation to time and place, endocrine changes. By the 3rd day of bed rest, there are reduced insulin binding sites. After 2 weeks of bed rest, it takes 2 full weeks of resumed activity before the glucose response returns to normal. To stay ahead of deconditioning, you should mobilize early, change positions frequently, maintain functional position of your head, trunk, arms, legs, hands, and feet, deep breathing, adequate coughing, and adequate hydration, active or passive range of motion exercises, prevent pressure development, adequate nutrition, proper skin care, maintenance of continence, progressive stretching, treatment of spasticity, surgical release. Remain stimulated, oriented, and social. Maintain a normal wake-sleep cycle. Encourage social visits. Get outside. Maintain a general exercise curriculum including strengthening, endurance, and coordination exercises. So much evidence exists about the impact of becoming deconditioned. Your illness may send you into a state of doing less, but consider the above, what I've said, before you surrender to the lack of movement and become deconditioned completely. Thank you.